So I'm currently a hospitalist PA, and I've been doing that almost 8 years now. But prior to that, I did primary care for almost 5 years. And I really, really like primary care. But there are things that I really like about hospital medicine too. And so this video, or these videos, are going to be about primary care versus hospital medicine, the pros and cons of both. So when I started primary care, I came from a fitness background. So I was a personal trainer for about a decade before I went to PA school. And so I was all about preventative health, wellness, things like that. And I would be the PA for whom, when you'd see me, I would say, well, I see all these medicines that you're on. Maybe we can stop some of these medicines or reduce them. Tell me what you're doing when it comes to exercise and diet. How are you sleeping? What's your lifestyle like? We could try and prevent disease. You know, my whole goal was to keep people healthy, keep them free of disease. And it wasn't just freedom from disease, but it's kind of optimal health. That was really my goal. And it's kind of an uphill battle a lot of times working with a patient that just wants a medication refill and doesn't necessarily want to be lectured about how they're exercising or eating or sleeping. Oh my goodness, all kinds of excuses would come out when I would talk about lifestyle. So many excuses. My favorite was people would say, well, yeah, I like to exercise, but it's been cold out lately. It's been cold out lately. And so I would say, oh, okay, so you mean to tell me half the year you just can't exercise because it's cold out? Oh, okay, all right. Anyway, they wouldn't like when I would say that. But what's really nice about primary care is prevention of disease, the relationships you form with your patients, okay? So over the 5 years or so that I did it, I would see many generations of patients, like 3 generations. I would see the adults in their 50s, their parents in their 80s, and then their kids in their 20s. And so that was great. I would see like a couple families, 3 generations of families for a few years, and you really become a part of the family. And then they trust you with their medical decisions. That's really, really nice. Now, some people don't like forming that kind of relationship with their patients, but I didn't mind it. So I really loved trying to prevent disease, forming really good relationships with the patients. But there's a lot of things that I also kind of didn't like. The number one thing was the hours and the documentation requirements. So I would say the most enjoyable part of patient care for me is interacting with the patients, communicating with them, advising them, educating them, okay, and listening to them. That part's really enjoyable to me, but that is the shortest part of the time you spent clinically. I would say as much, if not more, time was spent documenting. And a lot of times our EMR system now is documentation to increase your billing. It's like the EMR is like a cash register, like ZDogg MC would say, okay? And it's true. So that was the worst part of the job. So if you're real lucky, if you're doing primary care, you may have a patient slot every 20 minutes. If you're real lucky, it's every 30 minutes. But realistically, it's probably every 15 minutes. So you're seeing 4 patients an hour, maybe an hour lunch break or something. So an average day would be like 15, maybe 20 patients. By the time you get to 20 patients, your head's really spinning. And we're talking about primary care. We're not talking about urgent care. If these are primary care patients, sometimes with some sick visits, but a lot of chronic medications, doing a med rec, and like reviewing what happened with a consultant. Sometimes an older patient with a bag of medicines, it takes them 15 minutes just to kind of go over the medicines and warm up enough to talk about what's really going on. And forget it if the patient has like 3 things they want to address. Forget it. There's no way you're going to have enough time, not in a 15-minute time slot. So a lot of times we'd have to go over, okay, because I don't like cutting people off. And sometimes you have to. It sucks, okay? Because a person's waited a long time to see you and they have this tiny little appointment slot, And then they have to try and get everything out as fast as possible. And sometimes if someone's older, they talk a little bit slower. Sometimes they're not as great at expressing their symptoms in the way that we want to hear them, okay? Or in the way that is most useful to us information-wise. So we're often running behind. And what that would mean is I would have to finish charting after the workday was over. Just kind of take some notes in the room, try and remember as much as possible, and then finish the note at home. So I would see patients from like 7:30 to 2:30, 15 to 18 patients. And then I'd have to spend as much, if not maybe a little bit more time with each chart, kind of closing it and writing out my thought process, things like that. So every evening I would need to document for like 2 hours, 2 hours after I got home. That was a big drag. And actually, the point that made me realize this is just too much was one time my daughter needed help with her homework. I think she was like 8 or 9 years old at the time. She needed help with her homework, and I'm happy to help her. As I'm helping her with her homework, I casually mentioned to my wife, I'm like, I'm not going to have a weekend now because I'm going to need to finish my charts. All my charts are pushed forward one day. I helped her with the homework. Everything was fine. And the next day, my daughter comes up to me and she says, Daddy, I'm really sorry that I needed help with my homework, so then you couldn't do your homework. And so I was like, oh my goodness, no, I need to get a different job. So the documentation is what kind of put me over the edge. That's the one thing I didn't like about primary care. So if you're considering a career in primary care, outpatient internal medicine, that's fantastic. It's a great job. You really get to know your patients very well. You can think very deeply into their care. You get to prevent disease or try to prevent disease. And you try and kind of optimize a patient's health for the long term. That's great. Just be wary that sometimes there's a lot of homework involved, and sometimes the time commitments, the call schedule, all that stuff can take up a lot of your time. And to me, it always seemed like less of a job and more of a lifestyle. Sometimes when you have to kind of carry the pager and respond to calls after office hours, it really is a lifestyle. So that was kind of a con for me. Be sure and check out the next video when I talk about the transition to hospital medicine, and then I'll also talk about kind of pros and cons of both and what I think about where I am these days. So feel free to tell me what you think in the comments below.